Make the case. And for one thing, don't ever shy away from our progressive values. One person's socialism is another person's neighborliness. Just do the damn work. So I got to tell you, when I see this, it lifts me up. I'm inspired. I see it.
Another notable thing about Walz is that he served as governor during the COVID-19 pandemic. It's thus possible to parse his approach to the virus, and that record is extremely disturbing. Indeed, Walz's coronavirus policies were extremely heavy-handed and restrictive. Under his leadership, the state endured the pandemic in a fundamentally anti-libertarian fashion. Now, when the coronavirus was first spreading, Walz was an enthusiastic promoter of social distancing rules. He described the crowds in public outdoors spaces as a little too big. He even defended Minnesota's ridiculous hotline for COVID-19 snitches. That's right, Walz's government maintained a method for people to report their neighbors for failing to abide by social distancing rules. Walz insisted in that recent interview we just played that one person's socialism is another person's neighborliness. Well, denouncing one's neighbors as insufficiently loyal to government policies is, I suppose, his idea of neighborliness? Now, when asked by Republicans to take down that hotline, Walz responded, "We're not going to take down a phone number that people can call to keep their families safe." Though Walz instructed police to merely issue citations to people caught violating stay-at-home orders, which is still bad enough in my view, he also maintained the right via executive order to issue $1,000 fines and send violators to jail for 90 days. Now, his government maintained that private indoor gatherings should be limited to 10 people. Outdoor gatherings were arbitrarily capped at 25 people. That's just the science. On July 23, 2020, Walz declared a statewide mask mandate for most indoor spaces and even some outdoor spaces. Quote, "If we can get a 90 to 95% compliance, which we've seen, the science shows we can reduce the infection rate dramatically, which slows that spread and breaks that chain," Walz said at the time. "This is the way, the cheapest, the most effective way for us to open up our businesses, for us to get our kids back in school, for us to keep our grandparents healthy, and for us to get back to the life we all miss so much." Now, what followed was the implementation of one of the stupidest COVID-19 rules of all. Diners at restaurants had to wear masks while walking to their table, you remember this, and moving about the establishment, but were of course allowed to go maskless as long as they were eating and drinking, as if COVID cares what activity you're engaged in. Now, later in November and December of 2020, Walz issued and extended orders for restaurants, gyms, and other businesses to shut down. This included outdoor dining service for eating establishments. Now, over 150 businesses formed the Reopen Minnesota Coalition and urged the governor to relent, but Walz was unmoved. By the spring of 2021, vaccines were widely available for the most at-risk groups, and people who wanted to protect themselves from the risk of severe disease and death were able to exercise that option. It was only at this point that Walz partly relented and allowed widespread reopening. However, he kept capacity limits in place for many businesses. These nonsensical policies, the efficacy of which is now doubted by top U.S. health officials, with everyone, including Anthony Fauci, saying the 6 feet of social distancing rule was made up on the spot. This is not unique to Minnesota. In fact, these rules were commonplace in blue states all over the country. But Walz was as vigorous an enforcer of them as any of his Democratic peers. He was also one of the foremost defenders of a monstrous COVID-19 policy choice, sending sick, elderly patients back to nursing homes where the infection often spread to other vulnerable people, causing a disproportionate number of coronavirus deaths in such settings. This has been well covered by the media. Now, a cover-up of the nursing home deaths in New York actually brought an end to the political ambitions of one Governor Andrew Cuomo, who lied about his involvement in this policy in order to sell more books. But Walz was a fellow practitioner of this policy. In fact, Walz said it was, quote, "not a mistake to release sick people back to nursing homes." That statement alone reflects poor enough judgment as to be disqualifying for the pursuit of higher office. Pandemic policies are not nearly as salient today as they were 2 years ago, and so it remains to be seen whether Walz's record here matters much to voters. But for anyone who considers the COVID-19 restrictions to have been the biggest assault on liberties in our lifetime, as I do, Walz's VP candidacy should be a non-starter. Can liberty-conscious Americans really afford to sign off on a presidential ticket in which one of the people on that ticket implemented most, if not all, of the very worst, most egregiously authoritarian pandemic policies? Of course not. Now, Kamala Harris could have picked a Democratic governor whose COVID approach was more relaxed, more sane. That option was available. There's Colorado Governor Jared Polis, for instance, who actually canceled his state's COVID executive orders earlier than other governors. He declined to reinstitute a mask mandate when cases surged during subsequent waves, and there was pressure to do so. And he told the media that he didn't think people could, quote, be expected to live in an emergency state for years on end. Kamala Harris also could have picked someone who wasn't the executive of a state during the pandemic and whose record would at least be uncertain. Unfortunately, there's nothing uncertain about Tim Walz.
Robby, I'm curious if you think that some of the social distancing guidelines that Walz created, the hotline for people to report, that happened March 31st of 2020. Donald Trump was president. He was the person who appointed Fauci. It was his CDC and his guidelines that informed states just 3 days before Tim Walz was talking about this hotline, because people were reported to all be not social distancing at the public lakes of Minnesota. March 28th, 2020, the federal guidelines, this is from a White House press release, to prevent the spread of COVID-19, the White House extends all social distancing measures until through the end of April 2020. So Tim Walz was just enforcing Trump's policies during COVID. That's all he was doing as governor. So should he have not followed the guidelines of Donald Trump as president?
Well, Donald Trump didn't specifically tell him to implement a hotline for people to rat out their neighbors. But if your point is that Donald Trump's own COVID policies were far too authoritarian and far too deferential to a so-called expert class that ended up being horrifically wrong time after time about COVID, and in fact may have contributed to the creation of COVID in the first place by funding dangerous, reckless experimentation in China, yes, I agree with you. I don't approve at all whatsoever of Trump's handling of COVID either, and I have no particular eagerness to see him return to the White House because of that. So yeah, make no mistake, I am not at all satisfied with how Trump handled the pandemic. He put Fauci in charge of it, did nothing about that, and he's vulnerable on that issue. That's why someone like Robert F. Kennedy Jr. has won to his side some people who were otherwise Trump supporters but said, you know what, Republicans really lost the plot on COVID. They gave in to authoritarianism. They deferred to the expert judgment and are not trustworthy on that. So I totally agree with you on that specifically, but you know, I just have to look at Walz's record as governor of a state during COVID, and I would not want to live under this person's rule, given what went on. And also then the nursing home deaths is a particularly bad thing. I was surprised in my research to find him defending that policy, which was implemented in several states, that is he said it was not a mistake, it was clearly a mistake. You sent sick people into nursing homes, spread death. That happened in Michigan as well. It happened in New York as well. In New York, Cuomo paid the price for it because he lied about it.
Okay, let's talk about that.
Yeah,
because I get that you think the hotline thing is an issue because no one should be able to call this in. So should people not be able to call the police when a crime is committed? The calling is what you have a problem with?
People should call the police when a crime is committed, but your neighbors having like a barbecue with 11 people instead of 10 should not be illegal. It should not be something that police get called for. It should just be mind your own business. He said that the other day in his speech. He said, in Minnesota, we mind our own business, and that's a good thing. I agree with that. I wish that was his governing ethos, but it clearly was not during COVID.
Right, and so calling, someone to come in and say, hey guys, this isn't very safe, maybe you guys should spread out, you have a problem with that. That feels authoritarian to you.
Yes.
Okay, cool. So let's go to the COVID deaths. Tim Walz never covered up COVID deaths at nursing homes, which is what Andrew Cuomo
No, he didn't cover them up. He's admitting to them and saying we did the right thing.
And that policy was also a directive from the CDC under Donald Trump. That was the official federal guidelines at the time. Tim Walz was not the only governor who allowed people who, as he explained it, stayed in the hospital, had been determined to be stable enough to go home. They live at nursing homes. Yes, they were still positive. A lot of people went home still testing positive, but they didn't require hospitalization anymore, and the hospitals were overwhelmed. Sick people who needed immediate care needed to get into those beds. So should he have forbidden people from going home? How is that individual liberty?
I mean, these are, I don't know if I would put it as an individual liberty. It was
to be able to.
It was
go
a
home.
wrong. Well, they're living in.
The government should prevent you from going to where you live.
Well, the government should prevent you from going to where you live, but they lived in, publicly run nursing home facilities that are in many cases publicly run anyway, that are communal settings.
They were not all publicly run, no. These are private nursing homes. People pay rent.
Right, but it was
to
the
live in.
government's policy to tell the hospital that it is the best thing for you is to go back to that nursing home. Should they have forcibly detained them if they wanted to go back to the nursing home? No, but we should all recognize that policy choice resulted in rampant disease running through nursing homes and killing a lot of people who otherwise would have remained safe, would have not caught COVID.
That's not true. So hospitals were not told by Tim Walz that he should send sick people home. If someone was ready to be discharged, they should be allowed to re-enter their nursing home. As Tim Walz put it directly, it's actually more of a risk to have old people who were already at a high risk of dying from COVID and already live in close proximity with other old people in these nursing homes. But actually being in the hospital, it's a higher risk for old people. If you're going to die in an American hospital, Walz has said, he continued, the number one thing that will kill you is hospital-acquired infections. That kills 90,000 people a year. So if their immune system is already down, they're already sick. Being present in a hospital where, again, people immediately need those beds for life-saving care, someone who does not need hospital care should be allowed to go home, right?
But the home was a place where a lot of old, vulnerable people were, who would be. That's like, but it's making the problem worse overall.
But
then all those people got sick, and then they had to take them into the hospitals and get the kind of care you're describing that we were already overrun by. So the policy was like quintessentially short-sighted, because maybe we needed to ease the pressure on the hospital beds in the moment, but then we resulted in more cases of very old people because they went back to the nursing home.
But as a libertarian, don't you think if someone didn't want to live in close quarters with other old people and risk getting COVID, they could have, in their free will, left the nursing home if they didn't want that risk of staying where they pay to live and pay rent to make their home?
I mean, I guess. I don't really think it's a libertarian issue exactly. I'm just saying I'm not talking about the legal ramifications. I'm saying it was a wrong-headed decision, and I think it's not even controversial to say it's a wrong-headed decision. I think everyone admits that it was a bad idea to tell people, you still have COVID, but you're stable, so you should go back and recover in your nursing home.
That's what everyone did during COVID.
No, I know that's what they did. It was a bad idea.
Why? It was the official medical
Because it resulted in lots of people getting killed.
And so they should have stayed in the hospital. And what about the people who would have died because they can't get access to a hospital bed? We should just turn the hospitals into elderly housing?
They should not have been sent. That's what we sent them to elderly housing.
Where should they go then?
They should have stayed in the hospital.
And then what about someone who needs immediate care for life-saving? What if you have a heart attack and you can't
But you ended up with more people who needed immediate care, because by putting them back in the nursing home, you got tons more people sick. It spread the infection.
What should they have done?
They should not have done that.
What should they have done?
They should have kept them in the hospital until they were negative.
And what about the people who would have died because they can't access the necessary?
We're just going in circles. There were more of those people because more of those people got sick because they were in nursing homes.
No.
Yes, it is. It spread the infection.
To prevent access for people who need immediate care, COVID wasn't the only thing people were being hospitalized for. People have cancer, people have heart attacks, people have emergencies.
What do you say? We put people in masks. We put children who were at almost no risk from COVID in masks for years. We were willing to do that, but we weren't willing to find alternative accommodations other than old folks home for sick people? Are you kidding me? It makes no sense. That is the COVID lesson. Old people die of COVID at shockingly high rates. We don't have to mask all of society. We don't have to lock down all of society. We don't have to shut down everything. We just needed to keep old people, or especially when they all are gathered together, safe from exposure to the virus. And the policy was to put sick people who are positive for COVID in with the old people. It was the stupidest thing we possibly could have done. And with all the other elaborate lengths we went to keep cases that went naively and impossibly fighting an earthquake, because you couldn't actually do it. But we could have, in facilities where old people are gathered up, we could have kept them safe. We could have done more to keep positive cases out of those facilities than was done, than deliberately putting sick people purposefully by policy into the facility.
Robby,
that's what I'm objecting to.
Yeah. I understand that we have a lot more information now than we did at the time, and it's easy to look back and say what worked and what didn't.
Well, that's all I'm doing. I'm looking back and saying what worked and what didn't.
But we're judging Walz for his decisions as governor, which were to follow the federal regulations of Donald Trump.
I'm judging him for saying it was not a mistake. It was a mistake.
If you're going to blame Tim Walz for what he did under COVID, you can't say that his nursing home policy is his own, because he was following the regulations of the federal government with the best information they had. This was in March of 2020, in the beginning of the pandemic.
Just following orders. That's the excuse.
No, he was making decisions with the information he had, and hospitals were overflowing. There were people who were very sick who needed immediate care. And someone who's recovering from COVID, who's already had their hospital stay, could go home. It's important to note that a lot of the infections in COVID facilities were people coming in who were workers who were testing positive. That's what the data, now that we can look back, shows. It wasn't being spread among people who are coming back from the hospital, because we also know now that people with COVID-19 are infectious 1 to 2 days before and up to 8 to 10 days after symptoms begin. If someone's hospitalized for 10 days, when they come home, it's very likely they're not infectious anymore. These are old people who received care for COVID in the hospital and then were permitted to go back home to continue resting and recover, so that bed could be opened for someone whose life was potentially in danger.
My understanding was that they were sent back not when they were recovered, but when they were no longer in critical condition. They were stable condition, but they still were symptomatic and still had COVID, which is a dangerous zone to put them back with other old people.
Even with symptoms, it's 8 to 10 days. That is what the science shows.
Yeah, I see your point that, you know, nobody knew anything at the time, so mistakes were made and people were listened to who ended up being wrong. And I appreciate that this was not unique to Tim Walz, that this was federal guidance from people who ended up being, again, appallingly wrong. But I would just like to see it admitted that this was a mistaken policy.
You also understand hospitals are private entities, though, right? If a patient is stable, it's their standard of care that if they are stable and if they are fully able to recover at home, continue resting until they feel perfectly fine again, you're discharged from the hospital. You can opt to stay. You can say, I need more care. And that's a decision hospitals make at private entities. It sounds like what you're saying is the government should have mandated hospitals be required as a private company to keep people who didn't need immediate care in the bed when people who needed life-saving care needed beds.
The government did dramatic things to restrict our liberties, to compel us to wear masks as you walk to the table, and then you don't wear them while you eat dinner. The government compelled us to do extreme things that was largely unnecessary. The one thing that would have been useful was a more concerted effort to, call it whatever you want, protection or quarantine, to keep the actual at-risk population, very old people, separated from obviously sick people. And that was not done. That's all I'm saying.
So the government should have forcibly segregated people by age during the pandemic. Wouldn't that infringe on our liberties as well?
The government could have said, don't put positive COVID cases in with the elderly. And that would have been good guidance.
Okay, we're going to continue to suss out what the right has to say about Tim Walz. More Rising after this.